So coming to how the further development of the lung births happen after the uh, segmental bronchi, what we have seen, and all this division of the bronchi is dependent on the mesenchyme, the splanchnic mesoderm that is surrounding these divisions of the bronchi. And the developed tertiary bronchi or the segmental bronchi will be aerating a part of the lung that are called as bronchopulmonary segments. And these will give an access for a bronchosurgeon for resection of this particular part of the lung if there is any pathology that has to be dealt with surgically. So coming to how these lung birds are placed in their pleural cavities. So the growing lung birds, they expand caudolaterally into the pericardio-peritoneal canals. So these pericardio-peritoneal canals, they are the communicating channels between the pericardial sac and the peritoneal cavity. So during about 5th week, there is a fold that appears above between the pericardial cavity or the pericardial sac and the pericardio-peritoneal canal, which is called as pleuropericardial folds. And caudal to the pericardio-peritoneal canals, at about 5th to 7th week, there is appearance of pleuroperitoneal membrane, which will be dividing the pericardio-peritoneal canal from the pericardial sac and the peritoneal cavity. So when these lung birds, they invaginate into the pericardio-peritoneal canal, as they approximate and they push into the pericardio-peritoneal canals, which bulge to form the pleural cavities. So the layer which is adhering to the developing lung bird, that forms the visceral pleura, and the one which is along the body wall away from the lung bird will be developing into the parietal pleura, having a space in between into which these lung birds will be invaginating and developing into lungs. So here you can see this is what is the pericardial cavity or the sac. This is the peritoneal sac or the peritoneal cavity. These two are connected by the connecting channels, which are the pericardio-peritoneal canals, into which the lung birds are invaginating caudally and then laterally. Okay. So here, this picture demonstrates how the visceral pleura is formed, the layer that is adhering to the developing lung bird, and the parietal pleura that is formed, which is towards the body wall. So here you can see as this lung birds are invaginating into this pericardio-peritoneal canals, they go laterally, occupying as much the space within the pleuropericardial canals. This is the section that is taken at this level, that is at the pericardial sac level, where the heart is also developing. So in between the pericardial sac and the pericardio-peritoneal canals, there is a fold that is formed, what we said is pleuropericardial fold, which lodges the phrenic nerve and the common cardinal veins within the fold. So during the invagination process that's going on with the lung bud, then these pleuropericardial folds, they move towards each other and dorsally to fuse with the mesoesophagus, the outer layer here, the posterior layer. It fuses with the mesoesophagus, and the anterior or the ventral one fuses with one another, forming pleuropericardial membrane. When that procedure is happening, the left common cardinal vein degenerates. The right common cardinal vein will be forming into this inferior vena cava, the superior vena cava, the superior vena cava. So here what happens is, we said that there's also the phrenic nerve which is there present within the pleuropericardial membrane. So as this membrane grows towards the opposite side and fuses, and the heart is also developing within the pericardial cavity, and the lungs, as we said, are invaginating into the forming pleural cavities caudally and laterally, almost occupying the whole area. And still, as we said, there is development of the lung till the birth, and it extends beyond postnatally also. So the developing lung occupies the posterior aspect of the paravertebral gutters, and because of the rapid proliferation of the lung tissue, it even encroaches anteriorly between the sternum and the developing heart, which gives the anterior side, the anterior border of the lung, to be sandwiched between the developing sternum and the developing heart, which becomes sharp. That is the reason the anterior border of the lung is sharp, and as the posterior aspect of the lung, as it proliferates posteriorly occupying the paravertebral gutters, the posterior border of the lung becomes round in shape. And this thoracic cavity or the pleural cavity will be separated from the peritoneal cavity by pleuroperitoneal membranes. So we have dealt with the pericardio-pleural membranes. Now we have to separate the pleural cavity from the peritoneal cavity also. So that process is being done by pleuroperitoneal membranes. So this pleuroperitoneal membranes, this is what is the pericardio-peritoneal canals, which are dorsal to the septum transversum on either side of the developing foregut. Okay, and this pleuroperitoneal membranes, which are arising from the body wall, they are the peeled off structures from the body wall as the lung is encroaching on to the body wall during its development. This pleuroperitoneal membrane, they will be growing forwards and fusing with the dorsal aspect of the septum transversum, contributing for the formation of the diaphragm also, because it is the diaphragm that is separating the thorax from the abdomen. So as this grows and joins with the septum transversum, the lower end of the pericardio-peritoneal canals are closed and the pleural cavity is being formed by the closure of pericardio-pleural folds and pleuropericardial folds. So that's how the thoracic cavity is totally separated from the abdominal cavity. And because of this process, the phrenic nerve is seen associated along with the pericardium of the heart on either sides in front of the medial side of the lung. And as we said that the lungs, they descend down by the age of 6 at about C4 to C7 level. At birth, they are at about C1 to C4 vertebra. So this descent is also because of the descent of the septum transversum, which has formed in the cervical level only initially, contributed by second, third and fourth somoids. So that is the reason the nerves also taken up by those somoids only. So the phrenic nerve has its root value of C3, 4 and 5. That's how the phrenic nerve, which has been formed in the cervical region, descends down along with the septum transversum, along with the heart, because it is related to the heart because of its presence in the pericardio-pleural membrane, and then descends down to supply the diaphragm. So if the pleuroperitoneal membranes do not fuse, there can be this area that is being left not closed on one side, where under pressure the abdominal contents can enter into the thoracic cage, which is called as diaphragmatic hernia, where the abdominal contents herniate into the thoracic cavity through the improperly created developmental anomaly by non-fusion of pleuroperitoneal membrane to the septum transversum, contributing for the formation of the diaphragm. When the abdominal contents, mainly the intestines, which are mobile, that is the small intestine, into the thoracic cage, pushing the organs onto one side, there will be less growth on that side of the lung. That is called as hypoplasia. So on the right side, you can see the lung properly grown, whereas because of the pressure that has been created and the area that has been already occupied by the small intestine, because of the developmental deformity within the diaphragm, that side of the lung hardly has any space to develop. So there will be hypoplasia of that side of the lung where there is diaphragmatic hernia that is seen. And here you can see this is the diaphragm, okay, this is the heart. There can be ectopic lung that has developed beyond the thoracic cavity, that is extrathoracic right lung, which is seen within the abdominal cavity just beneath the dome, right dome of the diaphragm. Even the liver here is compromised for its formation. This is because when the retinoic acid, which is present in the mesenchyme surrounding the tracheoesophageal diverticulum on the right side, and its upgrading factor of TBX4 is not proper in that area but is seen elsewhere caudally on the ventral aspect of the esophagus, then this right lung will be seen just underneath the dome of the diaphragm, where it is originating from the abdominal part of the esophagus. So here you can very clearly see the absence of the third lung in the pleural cavity here. This is the left lung that has been developed. So these things can happen if there is any incoordination between these structures. Now coming to how these lungs are being developed. So they go through 5 stages. Initially it is the embryonic stage, usually that is clubbed with the pseudoglandular stage, where the embryonic stage lasts for a week time, that is 4 weeks to 5 weeks, 4th week to 5th week, because the appearance of the respiratory diverticulum itself is at about 4th week. So 4th week to 5th week, 1 week's time is the embryonic stage, where this is usually clubbed with pseudoglandular stage and coming to the 4 stages in the development of lung. And all these 4 stages will be overlapping one another during its development. So the pseudoglandular stage is the division of the bronchial tree till terminal bronchiole. So there is 14 generations of the divisions that happen by the end of pseudoglandular stage, where it spans from 5th week to 16th week of the intrauterine life. Then followed by canalicular stage, where there is formation of respiratory bronchiole level, and this stage spans from 16th to 26th week. And in the saccular stage, this one, or the terminal bud stage, you can call it as, where there is the development of terminal sacs that restrict the saccular stage. So that happens from 26th week to the birth, till the birth, where the alveoli are being formed. And the alveolar stage is the last stage, where it spans from the last weeks of the gestation to the 8th year of life postnatally, because the alveoli, they mature in the last weeks of gestation, but the generations of divisions that happen till alveolar stage are till about 17 to 18 generations. Rest of the 5 to 6 generations, they happen postnatally. That is, once the baby is born, then the last 5 to 6 generations of divisions occur, developing the lung into its total adult form. And during this alveolar stage, there is proper production of surfactant which line the alveoli, which is very important for the viability of the fetus. So let's see each stage detailedly. So this is another picture where it represents the developmental stage of the lung, that is the embryonic, pseudoglandular, canalicular, saccular, followed by alveolar, and we have seen what are all the things that are forming. Along with the bronchial tree division, there is division of the pulmonary arteries and formation of capillaries, wherein the pulmonary veins are also formed. So during the embryonic period, the pulmonary arteries, they are the aortic arches that arise from the truncus arteriosus and go to their respective pharyngeal arches, of which the 6th artery, the pulmonary artery, will be entering through the hilum of the lungs along with the division of the respiratory diverticulum. So in the pseudoglandular stage, where there is branching of this artery approximating with the branching of the airways and dividing into smaller and smaller arterial branches. And by the canalicular stage, that is at the end of the 26 weeks, the capillaries are formed around the, for the canalicular stage, we are at the stage of respiratory bronchioles, right? So even the respiratory bronchioles do have the outpocketings of the alveoli. But there is no indentation yet that is happening with the capillaries and the alveolus, the epithelium of the alveolus. So there is a very, very faint blood-air barrier that is being formed. By the saccular stage, there is thinning of both the endothelium of the vessels and thinning of the alveolar epithelium, because there is formation of the alveoli and the alveolar ducts, and there is formation of capillaries wherein the pulmonary arteries, they form capillaries and then they join to form the pulmonary veins, where there is this blood-air barrier that is being formed. And here in the last stage, the blood vessels, they indent the alveolar walls, and thinning of the area of indentation of both the vessel and the alveoli happen, having the basement membrane being shared by both the endothelium as well as the alveoli in this stage at that particular area, which makes the blood-air barrier very thin for the proper exchange of the gases. So coming to the embryonic stage, where it lasts from 4th week to 6th week, we can see the distal end of the respiratory diverticulum has divided and formed into lobules, which are called as lung buds, and these will divide into the primary bronchi and enter into the pleural cavity or the pleural sacs. By about 5th week, they divide into secondary bronchi. Of course, whatever we are talking, all these birds, they are surrounded by this splanchnic mesoderm, which is very, very, very necessary for the branching pattern of the bronchial tree. So by end of 6th week, the tertiary bronchi are also formed, which will be aerating a part of the lung segment after birth, which are called as bronchopulmonary segments. And as this is being formed, the internal lining of the respiratory diverticulum, and that will be forming into the intermediate part, as we said, is forming into trachea and further divisions of the bronchi, bronchioles and all that. So the epithelium also starts developing its various cells, and more of the respiratory epithelium is seen till the division of the bronchi, where there is ciliated epithelium. Ciliated cells are seen, goblet cells are seen, and all these brush cells, all these cells what we have seen in the histology of the respiratory tract, all those respiratory epithelial cells are seen, which is very, very important to function as mucociliary escalator, where the foreign particles that are adhered onto the mucosa that is been lining all the epithelium will be pushed out through the trachea and then through the nasal cavities. So let us now see the pseudoglandular stage, which spans from 6th week to the 16th week of intrauterine life. So in this stage, there is extensive division of the tracheobronchial tree, which takes about 14 to more divisions, or the generations of divisions, what we call, and formation of terminal bronchiole results at the end of the pseudoglandular stage, which is the conducting part of the lung that is being formed, or the conducting part of the bronchial tree is formed by the end of pseudoglandular stage. Beyond the terminal bronchiole, by the formation of the respiratory bronchiole, it is considered as respiratory part of the lung. So in pseudoglandular stage, there is total formation of conducting part of the bronchial tree by undergoing 14 or more generations of branching. And this branching is again influenced by the mesoderm, that is the bronchial mesoderm that is surrounding these developing bronchioles. And mainly the SOX2 and 9 genes that are present at the tip of the branching bronchioles, they influence the division of the bronchial tree more, along with the sonic hedgehog, which modulates the fibroblast growth factor 10, which is present in the mesoderm, which controls the branching of the bronchial buds till about terminal bronchiole. During this process of division, the interior of the bronchial tree also develops, transforming from the respiratory epithelium to the epithelium of the bronchiole, wherein the epithelium loses cilia and they become simple columnar, and by the end of the pseudoglandular stage, the terminal bronchiole develops the cuboidal epithelium. From the bronchiole level onwards, the goblet cells that are present in the bronchi are replaced by the Clara cells within the bronchiole divisions, which will be compensating for the secretions that line the epithelium, like the goblet cells that were lining the epithelium of the bronchi, which is very necessary for this mucociliary escalator, what we said. And the secretions of the Clara cells are necessary to regulate the surface tension between the air and the epithelium of the smaller bronchiolar divisions. And as the mesoderm is present between the developing capillaries, the smaller arteries, along with the divisions of the bronchial tree, and they are not approximating at any place. So there is a mesoderm that is present between the capillaries and the terminal bronchiole level. So there is no respiration that occurs because there is no gaseous exchange that happens at this stage. So a fetus that is born at this stage cannot survive. And there is no proper formation of the alveoli, and the alveolar cells also is the reason where the fetus cannot survive.